morning, friends and senior colleagues. It's my pleasure that I'm here between you, and I'm very thankful to the organizers of this conference because this is the first conference organized by Gynae fraternity where I would be going to present my work. So today my topic of discussion is bone marrow aspiration, processing and applications. You see, when we talk of the bone marrow stem cells or the bone marrow cell concentrate, so it is prepared by the way of gradient density fraction method. Obviously, the biomaterial is the bone marrow only, and it contains precursors of the hematopoietic and non-hematopoietic stem cells. Also, various growth factors and cytokines. So, when we prepare the bone marrow aspirate concentrate, we know already that it has various progenitor cells and MSCs and growth factors like IGF-1, hepatocyte growth factor, epidermal growth factor, transforming growth factor and PDGF and other cytokines. Why it is effective? Because it works like anti-inflammatory and immunomodulatory, and Dr. Lippi has very well explained you already. It has a paracrine effect on differentiation of the cells and tissue regeneration via various cytokine pathways. It has also anti-apoptotic effect, and it can produce the ECM, extracellular matrix also. This is very important actually quality of this BMAC because it is a wonder cocktail where we have all the three components, means we have the stem cells, growth factors as well as ECM. And its safety is par excellence because it is autologous, easily procurable. These are the adult stem cells, so greater biosafety and lower risk of tumorigenicity. So nowadays, practically every branch is using the stem cells or its derived products, and actually I am using more in orthopedics and neurology. But now infertility and aesthetic gynecology is also using it, pediatrics, and even in the gerontology, cosmetology, anti-aging, metabolic diseases, so many diseases are being covered by the use of the stem cells. So in orthopedics we are using these stem cells in degenerative arthritis of the knee, rheumatoid polyarthritis, spinal cord injury, avascular necrosis of hip, osteochondral lesions, delayed union and non-union of fractures, diabetic foot ulcer, critical limb ischemia and sports injury. So, a lot of indications are there, and practically now they have formed a new branch, orthobiologics, where we use only biologic material in orthopedic indications. And even in neurology, Duchenne muscular dystrophy, Becker muscular dystrophy, LGMD, FSHD, mitochondrial myopathy, spinal muscular atrophy, CP with global developmental delay. MND-ALS is very important because it is a no option disease. And they are also doing in Parkinson's disease and multiple sclerosis. But in infertility and aesthetic gynecology, I have recently found that it is being used as adjuvant therapy in IVF to increase the success rate. And infertility due to poor ovarian reserve, Asherman syndrome, vaginal rejuvenation, and post-radiation infertility. There might be so many other indications which I am not aware of. And other than this, in medical indications like diabetes and complications like neuropathy, nephropathy, immune-related early nephropathy, cardiomyopathy, ILD, lung fibrosis, also as adjuvant therapy in MDR tuberculosis. Especially its role has been already seen in post-COVID syndrome and rheumatoid polyarthritis and ulcerative colitis. In pediatrics, it is being used in CP with global developmental delay, Down syndrome and myopathies. In anti-aging, to prevent the aging, slow down aging and age reversal also. To combat the age-related debility, this is very important, fragility and diseases and body contouring and shaping. So now we come to the practical aspect. We aspirate the bone marrow from posterior iliac crest usually, but depending upon the surgeon's convenience, you can take it from the anterior iliac crest, posterior iliac crest, or even the middle part of it. So patient can be supine, lateral or prone. If supine, the aspiration should be from the iliac crest 2 centimeter away from the anterior superior iliac spine. I have kept one model of pelvis here on the one of the stalls, I think ambicell stall. So anyone who wants to see it, he will go later on and see it and discuss it. If it is lateral and posterior position, then aspiration should be 1 centimeter inferior to the posterior superior iliac spine. Why these points are so specific? Because there is a wider space and the thicker bone is there, and your Jamshedi needle will not go out of the aim area. So the aspiration can be done from 30 ml to 240 ml depending upon your requirement. But most important is you have to keep these vital organs and these and these nerves and blood vessels safe, because these important structures are there where your needle is going nearby. So you should be very clear where are you heading, and I will show you that whenever you wish to do bone marrow cell aspirate formation, you just give a local anesthesia. First you identify the posterior superior iliac spine. This is the L shape, this is the highest point of the iliac crest, and this is the posterior superior iliac spine. You do it like this. So once you identify that, then you inject locally, and before aspirating anything, you have to just heparinize all the Jamshedi needle and syringes so that the bone marrow doesn't coagulate. Okay? And you should also keep one system of filtration of the bone marrow, and that should be simply done by passing it through the BT set. So once you have given local anesthesia and you have the heparinized needles, Jamshedi needle we use, number 11, and once you enter, you have to keep in mind that after encountering the first cortex, maximum you can go up to 2 centimeter only. If you go more chances of going inside the pelvic cavity are there. So if you are entering from the posterior side, go straight anterior. If you are not finding the proper place, go a bit lateral and inferior, but never go medially. This is very important. If you go medially, you are going to damage any of the vital structure. So this is a very simple step, and I think all surgeons know the anatomy inside, and they are aware of the complications. So after filtration of the aspirated bone marrow, we transfer it to the processing cup. Okay. So we have kept here the machine and the actual processing cup also. So once we fill 25 ml of the filtered bone marrow in that processing cup, we give first centrifuge rotation. This is 2300 into 12 minutes, and once that is there, you can see just above the red portion, which is mainly RBCs, there is a reddish fluffy layer which is the mononuclear cells. So you have to push it. In the rightmost video, I am just pushing it by rotating clockwise so that it just crosses the blue line. Blue line is there in the center. And once that is there, we will hold from the top and rotate the middle one and lock it so that the mononuclear stem cells are in the upper chamber and the RBCs are in the lower chamber. Then we give the second rotation, and that is 2000 RPM for 3 minutes, and the lowermost in the upper chamber, the lowermost 4 ml is basically bone marrow aspirate concentrate. Rest is almost plasma. So you can see in the third picture, last 4 ml is there, which will be used as the bone marrow aspirate concentrate. So we are using in various indications, and we have published various papers on this. And like this paper, in which we use this combination therapy of autologous bone marrow derived mononuclear cells and umbilical cord derived mesenchymal stem cells in Duchenne muscular dystrophy, and proved its efficacy. So what we were discussing, that if you are going from the posterior side, this is the posterior superior iliac spine, okay, and you see this is a wider area, thickest and widest area, and you can enter straight anteriorly and go up to 2 to 3 centimeter, no problem. But never try to go medially, because the patient is lying like this. No, don't go medially. You can go a bit laterally, 5 degree laterally, and 5 degree if you go towards the hip joint also, no problem, okay, but never go medially. Similarly, from the anterior superior iliac spine, I told you go 1 to 2 centimeter posterior to it. Why? Because it is just like a tip, and if you go 1 to 2 centimeter posteriorly, then you will get the wider area. This is also important. And actually, this is actually used sealed cup, okay, and so we inject from here. Yes, this is the in. We inject from here, go up to the 25. So it is written in, this is written out. So from the in, you will enter and go up to the mark 25, okay, and put it for the first centrifuge. In the center, there is collapsible rubber, very small central collapsible rubber. So if you inject from here and remove the needle, there would not be any leakage, because it will collapse. And if you go from the periphery, all bone marrow will come out during the centrifuge. So this is a very important point. So after the first, usually RBC is up to this place. So we just hold it like this and rotate it like this, so that it goes up to the blue mark. This is the blue mark center, okay, and then we hold top and rotate this one. So upper chamber is separate and the lower chamber is separate. So 2 rotations are there after first centrifuge. This is important. So first is just hold in the center and rotate this one, so that it goes up to the blue mark. Then hold the top and then rotate the center one, okay, so that you lock the chamber separately. And once it is there, then you go for the second centrifuge, and the last 4 ml, this is 4, written 4. So from 4 to down up to this, that is the most concentrated part, that is to be used only. So this is one of the cases of the Duchenne muscular dystrophy, which came to me recently. You see that the child is having the power of grade 1 to grade 2 in both the lower limbs, and unable to stand, but his father was insisting. So he tried to stand, but he fell down immediately. You see, and when we gave this autologous bone marrow cell transplant with some growth factors, and just see the recovery in just 4 to 6 weeks. So he sent this video from Uzbekistan. Thank you. So I just want to impress upon you that God has given wonderful gift to us for the intractable problems, and we should know how to use them and where to use. Similarly,
आयुष आनंद, आपकी उम्र 21 साल है और आप ड्यूशेन मस्कुलर डिस्ट्रॉफी के पेशेंट हैं, और जब किसी प्रकार के ट्रीटमेंट से आपको फ़ायदा नहीं हो रहा था, तो आपने स्टेम सेल ट्रांसप्लांटेशन कराने का डिसाइड किया हो। 2 सेशन आप ऑलरेडी ले चुके हैं, आज 3rd सेशन लेने के लिए आए हैं। दाहिने हाथ को उठा करके दिखा सकते हैं आप। ओके गुड, नीचे लाइए, नीचे लाइए। हाँ, बाएं हाथ को भी उठा लीजिए, कोई बात नहीं है, अगर उठा सकते हैं तो उठा लीजिए। नीचे लाइए, चलाइए। दाहिने पैर को उठा सकते हैं क्या? जितना उठ सकता उतना बताओ। ओके, बायां हाथ दिखाओ। ओके, सो अपर लिम्स में ग्रेड 3 पावर है और लोअर लिम्स में ग्रेड 2 पावर है आपकी। ओके, इनको जरा बैठा लीजिए। ठीक, सामने झुकिए ज़रा। हाँ झुकिए झुकिए, कोई बात नहीं, और झुकिए और झुकिए। हाँ सीधा हो जाइए। ओके, अब आप मुझे ये बताएं कि जो पिछले 2 महीने में 2 सेशन हुए आपके, उससे आपको अपने बॉडी में कोई चेंज महसूस होता है?
कोई चीज़ उठाने में ऐसे करके गिलास में यहाँ पर लेने में से।
अच्छा,
पहले यहाँ पर नहीं रहता था ज़्यादा देर तक।
अच्छा, पहले यहाँ तक नहीं रह सकता था।
और
सो के उठने में भी आसानी हुई है आपको।
हाँ।
और कोई बॉडी में चेंज महसूस करते हैं आप? थोड़ा बॉडी में फ्रीनेस आई है। ठीक है, जो बेस्ट पॉसिबल ट्रीटमेंट है वो आपके लिए करेंगे और आज हम आपको 3rd सेशन देंगे। ऑल द बेस्ट। सांस वगैरह तो नहीं फूलती है? ओके, सो okay, even you can lock your knee, so this is also important achievement. Okay, and you can stand without even using any gaiter. Okay, all the best. We will give you the next session of autologous bone marrow cell transplantation today. This is a landmark patient of the Duchenne muscular dystrophy. Normally all the patients die between 13 to 23, and this patient is coming to me for the last 11 years, and now this patient is married and having 2 children. And every year he comes and takes 1 session of the stem cell therapy and goes. And we also did the retrospective analysis of the role of the autologous bone marrow derived mononuclear stem cells in the management of degenerative arthritis of knee, and we found that it reduces the signs and symptoms of the ONE, but multiple injections are needed as its repairing capacity is not too much, but to a certain limit only. And in the higher grade, it is not giving very good results. So we are using it in grade 1 and grade 2 only, and up to early grade 3. You can see the just changes in the MRI, that there was subchondral cyst, edema, as well as the cartilage breach, and just in the few months there is definite change in these MRI, and you can see the repairing process is in place. So similarly, so many other cases are there. This I will show you the improvement in lady who was very difficult to walk or stand even properly, and just in a few months after the stem cell, she is very comfortable, and she was just 78-year-old. So we were here, and then it hanged. Actually, I was showing the case of Duchenne muscular dystrophy, and this was the patient on the left side when he came to me, and after bone marrow cell transplant, who was not able to stand before, started walking within 1 month. And this is again the case of Duchenne muscular dystrophy, coming for the last 11 years for the stem cell transplant and still alive. Now his age is 30. Normally the survival age is up to 24 to 26. And now he is 30 and having children. And then we did the role of the autologous bone marrow cell transplant in management of osteoarthritis knee. and we had showed our results on this one on MR cartogram, and we have shown that the subchondral cystic lesion disappeared, edema disappeared, and the chondral defects were repaired after few months of the bone marrow cell transplant. And these are the patients, some of the patients. This patient is 78-year-old lady. You can see is in the right knee, and there is significant loss of the medial chondral space, and this lady started walking very well after only one session of the stem cell transplant. So till this period we have already shown. In the cases of the avian hip, it is being used, autologous bone marrow cell transplant, for the last roughly 30 to 40 years. It's not a new thing, and its efficacy is beyond doubt these days. And currently we are doing autologous fat-derived cell transplant in avian hip cases, and which has the positive point that we need not to do core decompression or to ask the patient to go for the rest for 3 months. And even in spinal cord injury, we have shown its results. Even in this case, who came to me after 6 months of the spinal cord injury as a case of paraplegia, and he started walking within 3 to 4 months after the bone marrow cell transplant. This is again a case of the spinal cord injury with paraplegia, fractured D5-6, Asia A type of injury, which is very, very difficult to repair. And you see, just after 2 sessions of the autologous bone marrow derived mononuclear cell transplant, he has got the knee locking, and he started walking with the minimal support. So these are very important cases because the patients are lying for the last 20 years to start their capability to walk independently. And if we can help them, it is just like service to the mankind. And we have done a lot of cases of the bone marrow derived mononuclear cell transplant and growth factors in ALS. And in the ALS, we injected this BMMNC intrathecally and intramuscular, 4 sessions at 3-monthly interval, where extraction of the 60 ml of bone marrow was done, and it was processed with the FDA approved kit. And in the form of growth factor, we used only IGF-1 4 international unit on alternate days for 3 months. And out of our 48 patients, 36 were in treatment group and 12 in control group. And with the help of the revised ALS FRS scoring, we could ascertain that there was stability or improved patients were 30% at 12-month assessment, and their decline was at the slower pace in 40% patients and no response in 30% patients. You might be aware that a new treatment of ALS by Narvan in US is costing crores of rupees, and recently FDA has declined to give it permission also. And they also claim the similar results. So in fraction of the expenses, we can give the same results that the patients are getting after spending crores of rupees in US. So you can see the patient on the left side who could not take even the side turn is taking the side turn and sitting freely and having hand movements. And again, you see this patient on the left side, when he came, his wife is supporting to get up. And on the right side, after 1 month of bone marrow cell transplant, you can see that he is able to stand on his own. So we concluded that the autologous bone marrow derived mononuclear cell transplant is a safe and effective in relieving pain due to various diseases, especially arthritis knee, hip, avian hip, and spinal cord injury, sports injuries, and various other disorders. including motor neuron disease or ALS. And a combination of bone marrow MNCs and growth factors improves the outcome. This is the photograph from my theatre in GSVM Medical College, where I am the visiting professor, and we are doing stem cell transplants at the routine surgeries, and we have done 200 surgeries in last 2 years. Thank you very much.